So let me share my screen. Okay, hi everyone. So again, we are now going to do the retina image based questions, and the rule is same. First, I will check. Okay, so yeah, it's working. So again, there are 10 questions, and we'll go one by one and give you time to solve the questions. Those who are attending live, for those who are seeing recorded, they can pause and answer the questions. But you should have a time bound. So this quiz series of YouTube is also my aim is to make you have a good grasp of time as well, because you will not get 5 minutes to solve a question. So I'll give you particular time. I know what time should be there to solve a particular question. So let us see. I'm starting the quiz. 10 questions in the retina images. I'm starting with the question number one. Hi Asim. Nothing to, no need to answer live. Just evaluate yourself when I discuss whether how many questions you have done correct or not. Best wishes. So this is the first question. No need to answer. No need to answer. Second question now. This is enough time to solve this. If you know, you know. If you don't know, you don't know. Second. Okay. Should be okay. Third. So Hamadim, nothing to answer, please. Just do it yourself. I'll give a little bit time in this. Neetej Mishra, keep your answers to yourself. No need to answer. Okay. Should be okay. Next question. Question number 4. A little bit of retina is blocked by me, but doesn't matter. All the signs which you should know to solve the question are visible. If you don't believe, see, nothing here. Okay, this is behind me now, nothing here. Only the air is there, but other parts also have some important things. I'll give you slightly less time for this because this is a repeat question of the previous years. So I'll go to question number 5 now. Neeraj Mishra, please don't answer. Do you want me to block the live chat? No, no, please. It's for self-evaluation. See carefully. Huh? See this? I'll give you options. Just see carefully. Now see. Okay. Next. Question 6. Aditi, you don't have to answer. I told you. Please self-evaluate. I'll give you time to answer in the. I mean, when I discuss, then you can answer. Okay. Next. No problems, Neeraj. Try to solve the 7th question now. Okay, Aditi, solve this question. Okay. So you want to think. Okay. Question number 8. All right. Question 9th. Will be the last question for you to solve because 10th question I will do explanation and live together. So 9th question. Oh, Chitra is very. Now this question B option is coming behind me. So just see, and then I will do like this. Okay. Let us see if it is coming. Yeah. Now it should be okay. Or what I'll do is I'll keep it here. I'll keep the question there. Okay. Now should be okay. The question is which of the following will require oral antioxidants as main management? स्वाति राय सॉल्व तो करो बढ़िया क्वेश्चंस आंसर कर रहे हो सॉल्व तो करो okay now the 10th question I'm still giving time for this because the 10th question हाँ तो नित्य it's in the pinned messages in my group Schedule. I told you in the last time. Schedule it will be the same sequence of the topics which I did previously in season number 1. Alternate day quiz will be there, so you can check for yourself. Initially, basic investigations in lens and retina. The next, see the list of the previous questions. So have you done the season 1 questions, Nitya? Then you know what will be the next quiz. Or I tell in the group as well. Okay, so the 10th question I'll give you live to solve. So these are the 9 questions. This will be the 10th question. You have to see this question. I'm not giving the question. What is the question? I will ask the question when I will solve the all the 10 questions. Okay, now I've given ample time. Now let us see to solve the explanation of the 10 questions. The first is a uh, animated images of the retina in which some layers and the cells are given in the retina. This D option is a rods and cones outer nuclear layer. Now you can type if you want. Yes, it's the outer nuclear layer. From here, the impulse goes via outer plexiform into bipolar cells. These are Muller cells. That's the microglial cells transpassing the entire retina. This is the inner nuclear layer. This is the inner nuclear layer. This is the outer nuclear layer. This is the outer plexiform layer. This is the inner plexiform layer. And the answer to the question is ganglion layer is this, whose axons are nerve fiber axons, which forms the optic nerve, which goes and crosses optic chiasma, optic tract, LGB, lateral genital body, optic radiations, and visual cortex. Phototransmission in 124 milliseconds. Ganglionic cells are the first cells to be damaged in glaucoma. That's why glaucoma there is an optic neuropathy. So that's the first explanation, the first question. The second question, a retina image is shown to you. This is a optic disc, and this is the artery or vein. This is the artery because the lumen of the artery is narrower than the lumen of the vein. The arteriovenous ratio is 2:3. Now, these are branches of central retinal artery and central retinal vein. This is retinal artery, true. This is the intraretinal, yes, because it is inside the 6 layers of the retina. The superficial branch at the level of nerve fiber. The deep branch is at the level of inner nuclear outer plexiform. To solve the question, it can be taken as outer plexiform. Now, this is central retinal artery is a branch of ophthalmic artery. Ophthalmic artery is a branch of internal carotid artery, not an external carotid artery. That's the answer. So even if you don't know the C option is true because if you do angiography, you put dye in the antecubital vein, it goes to the heart, it goes to the retina. First, it go to choroid and then go to retina. That's why this option is true. First, choroidal vessels are filled, then retina vessels are filled. Arm retina time is 11 to 12 seconds. In the retina, it goes to artery first, then vein, and then goes outside the eye. The stages are not known. That is angiography. First choroidal vessels and then retinal vessels. So C is also true option. D you should know. That's why C is a true option. If you know, even if you don't know the C, doesn't matter. But you should know it's the internal carotid artery system. So that's the second question. The third question is the investigations of the retina. The patient is wearing thick glasses since childhood, now comes with floaters, sudden painless vision loss. What can be the answer of this? It could be retina detachment, it can be vitreous hemorrhage. But here it is written, it is a dull reflex observed on distant direct ophthalmoscopy. In retina detachment, you can see the retina. Here there is a dull reflex because of vitreous hemorrhage. So answer is vitreous hemorrhage, and which is useful in this scenario. Ultrasound B scan is to see the posterior segment in cases of media opacities. That's the answer of this question. A is the optical coherence tomography. C is the amsler grid. D is the angiography. There's a no role in vitreous hemorrhage in A, C, D, and B should be the answer of this question. Somebody was asking how to differentiate ultrasound B scan from A scan. Both are same in A plus B. In A, there are spikes like this. There will be a corneal spike, lens spike, retina spike, which will give you the axial length as well. So A and B are same principle actually. Floaters, I am Shravan 45 is asking C is amsler grid. Amsler grid is used when there is a macular pathology like central seizure retinopathy, like age-related macular degeneration. This is not for, if you have to have a central vision dispersion of the rods and cones, then there is a metamorphosia. That is the amsler grid. So C is not no role in vitreous hemorrhage. I hope you know the diagnosis is vitreous hemorrhage, and B should be the answer of this question. Good answer, Janvi. So this is the right retina, the management of the patient with diabetes mellitus for the last 15 years with 6-9 visual acuity. 6-9 visual acuity is a very good visual acuity, but many people must have answered this question observation because the visual acuity is good. But no, even if the visual acuity is good, because the central retina don't have anything. But see, this is the optic disc. I'll zoom it. This is optic discs. disc. This is the retinal vein. This is the retinal artery. These are normal vessels. These are abnormal vessels on the optic disc. Actually, these are abnormal vessels in the elsewhere as well. So these are abnormal vessels elsewhere. These are abnormal vessels of the optic disc. This is new vascularization. And if there's any new vascularization of the retina or even iris or glaucoma or angle, it's a proliferative stage of diabetic retinopathy, and the primary treatment is pan-retinal photocoagulation. Unnati Goel, very good answer with Swati Roy as well. Dharya Shweta, also very good answer. So the visual act is 6-9 because the central retina does not have any major changes, but still there is a new vessels. That's what the answer is, pan-retinal photocoagulation. I zoomed this to show there's a right retina having a macular edema. Edema in the macula but sparing the fovea. Fovea is spared like a cherry red spot. Cherry red spot differentials are very important. It can be seen in ocular conditions like central retinal artery occlusion or blunt trauma, Berlin's edema. Or it can be seen in systemic conditions like cherry red spot seen in Tay-Sachs disease, Niemann-Pick's disease, GM1, GM2 gangliosides, Sandoff disease. So it is an ocular condition because the patient has ocular symptoms. This CRAO patient presents with sudden transient vision loss that is known as amaurosis fugax. Very good answer. Sudden painless vision loss with floaters can be vitreous hemorrhage or retina detachment. Like differentiation I told in the previous question. Sudden painless vision loss with flashes goes in favor of retina detachment because the retina is detached, causing a flash of the retina, particularly rhegmatogenous detachment. Gradual painless vision loss has so many conditions, like in retina, and can be age-related macular degeneration with metamorphosia, or it can be cystoid macular edema, the most common cause of vision loss in diabetic patient. Here the answer is amaurosis fugax, that is transient blindness, central retinal artery occlusion. Now A6 is also right retina having a splashed tomato blood thunder appearance, having flame hemorrhages. Sometimes there can be some cotton wool spots all over the retina. This is central retinal venous occlusion. Why it is not a central artery occlusion? Because there is no cherry red spot here. Why it is not a branch? Because the entire retina is involved. The occlusion is at the level of optic disc, at the lamina cribrosa. That's why all the four quadrants have central retinal vein occlusion. If there is a branch retinal vein occlusion, the hemorrhages exudate will be in the one quadrant. In CRAO, the previous picture, it was a cherry red spot. Some people ask how will BRAO picture will be given. It will not be given, but it will be ganglionic edema in one quadrant. Edema will be in one quadrant of the retina because one artery is involved. But cherry red spot will be seen in CRAO, and 100-day glaucoma is also seen over a CRVO, blood thunder appearance, and splash tomato appearance. 100-day glaucoma, it takes from NVI area to develop NVG. It takes 90 days, 100 days. So NVG, neovascular glaucoma in CRVO is known as 100-day, 90-day, or 3-month glaucoma. How does glaucoma occurs? New vessels can block the trabecular meshwork, causing open angle glaucoma. Later, it can pull the iris upwards, causing closed angle glaucoma. Secondary open first, secondary closed later. Now, this is the angiography because you can see the vessels have some dye. Now, very common mistake what you people, I know many people might have marked the answer is black, the false statement. You have to pick the false statement. What you must be knowing that marking that this black one is a cotton wool spot. No, cotton wool spot is a fundus picture, not an angiographic picture. This is a microaneurysm, the small dots that is seen in very mild NPDR stage. But this is now a progress because this black area is hypofluorescence, that is a hypoxic area. That is true statement A. Black is not cotton wool spot. Black is hypoxic area releases VEGF. VEGF causes new vessels. New vessels are abnormal vessels. They are above the retina. They leak the dye. That's why new vessels are hyperfluorescence. This black arrow is not cotton wool spot. Cotton wool spot is a fundus picture. Yellow area has microisms, and this is if there's a new vessel, there's a PDR stage, as I told you in the previous question. So please remember, only two signs at your level are hyperfluorescence and angiography in diabetic mellitus, one diabetic retinopathy. One is microaneurysms, another is new vessels. Now, if they want to ask you a OCT picture, optical coherence tomography, these are the four pictures they can ask you. The first picture is showing the macular hole. It's an idiopathic condition. It is because of sometimes posterior vitreous is pulling the retina, causing a macular hole. Only for identification can be asked. B is, I hope you know, this is the retinal pigment epithelium, and the 9 layers are neurosensory retina. All the 10 layers are separated. That is pigment epithelium detachment, can be seen in age-related macular degeneration. C is a increased thickness of the retina, that is because of inner blood-retinal barrier break, having cystic spaces in the retina, that is cystoid macular edema, can be seen in prostaglandin drugs like prostaglandins, niacin, adrenaline, myotics, can be seen in any stage of diabetic retinopathy, can be seen in any branch retinal or central retinal vein occlusion, or it can be seen in inflammations like after cataract surgery, Irwin-Cass syndrome, or it can be seen in posterior uveitis, pars planitis. That is cystoid macular edema. This is also most common cause of vision loss in diabetic patient, most common cause of vision loss in pars planitis, that is intermediate uveitis. The treatment depends on the cause. Here I've just asked for the diagnosis. Now D is central serous retinopathy because only the central part of the retina is detached. 9 layers are separate from 10th. So somebody asked today CSR, what is the difference of CSR, central serous retinopathy, and the retinal detachment? There is no difference. Both are same. CSR is an example of central exudative retinal detachment coming in a young male, central vision loss, metamorphosia, under stress, क्या पता intern हो, क्या पता शादीशुदा हो, नहीं सारे शादीशुदा यंग मेल ऐसे नहीं रहते, सिर्फ 99% रहते हैं, वो अलग बात है. So that is a outer barrier break example. Increased fluid is coming from choroid, having central retinal detachment. Here there is an inner retinal barrier break, having increased thickness, that is cystoid macular edema. अब किसी ने सुन लिया होगा तो फिर मेरे को घर से बाहर जाना पड़ेगा, तो मैं फटाफट से खत्म कर देता हूँ. The 9th question is a 4 pictures which can be asked. Which one of the following requires oral antioxidants? So let us see one by one. I'll zoom, I'll show you one by one. So this is नहीं, वो मेरे लिए वैलिड नहीं है क्योंकि मैं यंग नहीं हूँ, मैं ओल्ड हो चुका हूँ. वो यंग मेल्स के लिए होता है. So this is A is left retina. This is some yellow thing deposits on the central retina, only in the central retina. Now this might be an old patient because this is like me, more than 8 years old, because I already told you that I 100 years back I've done this all this. I'm teaching ophthalmology since last 100 years. I'm studying this for the last 100 years. So this can be seen in my retina. Age-related macular degeneration. These are drusens in the Brooks membrane, which can push the retina upwards, causing pigment epithelial detachment as well. And that is the answer. That is oral antioxidants are given. So B option, if you see carefully, this is the left retina. Observer's view. This is cotton wool spot, a big fluffy margins. This is hard exudates, small shiny things with some hemorrhages, flame hemorrhages, dot and dot hemorrhages. This is a diabetic retinopathy. Staging cannot be asked because they can't ask you. This can't be very mild NPDR because very mild has only microaneurysms. It can be mild to moderate NPDR, but that question cannot be asked because severe, very severe signs like venous bleeding and irma cannot be asked for you to identify. But if it's a diabetic mellitus patient, you can ask the signs. This is flame hemorrhages and nerve fiber. This is hard exudates in the outer plexiform. This is soft exudates, that is infarction of the nerve fiber layer. Now, if you see this option number C, these are also. Can you tell me C? Anyone? You can type now. Typing तो तुम्हें बहुत करनी आती है. अब बताओ C option क्या है? What are these C options? These are drusens or hard exudates or soft exudates. Yeah, sweetie gold, that can be in the macular appearance. Yeah, this is what this is. This is hard exudates, small shiny yellow ones. Not only in the macula but everywhere. That is hard exudates. Very good answer, everyone. And D option, these are what? These are yellow ones. These are large fluffy margins. These are soft exudates with some flame hemorrhages. Okay, that goes in favor of hypertension as well, and which can lead to central retinal vein occlusion because of tortuous dilated vein can also be there. So answer over here is that is age-related macular degeneration is having oral antioxidants as dry RMD. Answer is option number A. Now let us see the 10th option. 10th question is slightly difficult. My question you have to answer now. My question is which ABCD, which is the abnormality? ABCD, where is the pathology in this question? And if you answer the pathology in this question, I will tell you that I will ask you the diagnosis as well. Excellent answer I'm getting. So if you see carefully, if you don't know, but you should don't know the diagnosis, you at least you should know step by step that this is the optic disc, this is the retina vein because the lumen is bigger. This is the retina artery. So A is a retinal vein, C is a retinal artery. These are normal, and B is the optic disc. Even if you don't know, then D, A, C, D are normal. You can rule out the normal to know the D is abnormal. The D is the cracks of the Brooks membrane, Very good, sweetie. Step by step, you can answer that. D is the cracks of the Brooks membrane seen in angioid streak. Now, two cracks can be seen in Brooks membrane, one in high myopia, but there is no feature of high myopia here. Other that is known as lacquer cracks. And other cracks of Brooks membrane is congenital in angioid streak, like in patients who are very hyperflexible, like Pepsi, Paget's disease, Ehlers-Danlos type 6, pseudoxanthoma elasticum, sickle cell anemia, incontinenta pigmenti. I'm Shravan 45. Excellent answer. So these are the 10 questions. Let me know how many questions you have got correct. 8 above is always good. And I'll give you a grace mark because retina picture, standard picture should be asked, then only you can answer questions. So 7 also is a good number. Let me know, or let me know in the group as well, or individual chat. And I hope I have, from last 100 years I'm writing this book, and today I have launched this book, Nephrology. I've shared links also many places, and I hope it will be helpful for you in solving the questions later on. All right, good answers, everyone. 7 above is good. I've got 8 also, 9 also. All right, thank you very much, and best wishes. I hope I am not thrown out of the house now. Bye bye.